Good evening, ladies and gentlemen. Thank you for making it to this room. And within the World Water Week, there are lots of things which will unite us and maybe separate us as well. But I think the one thing we can agree at the moment is being cold is uniting all of us. And part of that comes from some of us not reading the forecast properly, and some of us sort of saying, how can it be this cold in August in Stockholm? But welcome. And to warm ourselves up, I'm just going to ask everybody to join me in a single clap. All I want you to do is put your things down, take your hands, and go. Oh, come on, folks, we can do better than this. All right, 1, 2, 3. That was much better. Right, my name is Masuma Faruqi. I'm with One World Sustainable Investments, as is Belinda. And we are a think tank, a consulting service, and we work on the simple idea of building resilient futures. And nothing is more important to a resilient future than children. And protecting children is not just about getting them to survive right now. It's about their health and their resilience and their rights, because they will become the future generation which inherits a planet which is partly in crisis, but partly surging forward. So children health and rights, part of that is associated with access to water, sanitation, and hygiene. And climate change is becoming a threat to WASH services. So in our discussion today, in our presentations today, we're looking at institutional arrangements and processes which help with WASH frameworks, and we'll have UNICEF speak to that. Our online presenter is then also going to talk about best practices that come from the field, that come from case experiences, and talk about WASH frameworks and the next steps and how they will work. And then we will have a panel discussion which says, like everything else, where is the money and the investment and the institutional framework and the progress and the next steps going to come for this? The idea behind all of this is we need to make things work. And I'm sure some of you have been saying that for 30 years. And I'm hoping to get to a conference before I die where people say, yep, job done, we got there. I'm not expecting that to happen, but there is always hope. I am going to hand over to Belinda Petrie, who is our CEO and has also been doing this for more decades than anybody would like to admit. And Belinda is going to set the scene as to what our panel and conversation is going to be about today.
Thank you, Masuma. Apart from the more decades than anyone would like to recall, I'll let that part pass. And greetings, everyone. It's very exciting to be back in Stockholm for World Water Week. It's really exciting to be back with all our colleagues, and we're really looking forward to this conversation, which has been born out of around about 6 or 7 years of One World working with various UNICEF country officers, and UNICEF is on our panel today, in Eastern and Southern Africa on this question of child resilience and why are we treating children as if they were just little adults, which of course they're not. And years now of digging around into the reality of that context, particularly in the context of climate change and building climate resilience, is part of what's got us here today. But I will also say that UNICEF, who you'll be hearing from shortly, has been hugely instrumental in One World's work in the resilience space. We also work a lot at the Nexus level. So we are here today to talk about the climate, the child climate WASH and resilience nexus, but there's a broader nexus component, which is around the water, energy, food and ecosystems nexus that we also work considerably at. And health, human health is always downstream in that broader nexus context, and we also have a panelist that will touch on that today. So we are here to talk about children today. We are here to talk about resilience. We're not looking at resilience in terms of the ecological definition, which is about bouncing back to a former state. We're actually wanting to talk more, and this I think is probably one of the most important threads to hold through for today's conversation, but to talk more about how to make sure that children can thrive despite the disruption in this instance of climate change. So it's not just about bouncing back. It's about actually having a real chance at a really good future, which is what any of us that have children, grandchildren, etc., would want for our children. And one of the colleagues in an earlier session this morning was talking about resilience and framing resilience, and he was talking about his own child, and that he's observed that a child evolves through time. What it is at the age of 6 months is not what it is at the age of 8, at the age of 15, and not what it is until it gets to being an adult. It's always not a little adult. And he was raising the question in the context of resilience of what kind of parents do you want to be? And we're asking our panelists a little bit later as to what kind of future do we want to create for the children that we want them to be, because in the end, society and the economy relies heavily on those children coming roundly and healthily into the future. So with that, I'm going to ask our panelists to come up.
Presentations.
Oh, sorry, I forgot about the presentations. No offense to our two presenters. So, Masuma, let me hand back to you on the presentations. But before we do that, just a couple of last things. We've come at the session very much from a just transition perspective. In other words, the transition to low-carbon, climate-resilient society and economies should not happen at the detriment or at the cost of Africa, because we are talking about Africa here today, at the prospect of their economic growth and development and prosperity aspirations. And I think when I was thinking about that just transition principle and the principles that go with it, like the precautionary principle, principle of preventing significant harm, the climate justice principles, etc., I just kept thinking that nowhere are those principles more appropriate or relevant than for our children. And I think it's with that in mind that UNICEF embarked on this work in the first place, but we'll hear from them now. So over to Masuma.
I think the principal idea behind this presentation is to make sure children are not invisible. And that, I think, is what Kitka Goyal, he's the WASH advisor for UNICEF Eastern and Southern African region, is going to talk about the processes and institutional arrangements that ensure children are included as we develop policy and climate finance processes as we go forward. So, Kitka, the floor is yours, please.
Thank you, Masuma. Good afternoon, everyone. And it's really a privilege to have this opportunity to showcase and to share with you some of the work ourselves have done, but in partnership with One World. And want to thank them also for this session. The climate crisis. I think we cannot talk about the climate crisis without mentioning children, because it is a crisis that is impacting on the rights of each and every child that is on the globe today. UNICEF has undertaken some studies, and what has come out of it is the fact that it is a crisis that is affecting basic social services. What does that mean? For the health, what does that mean? For the nutrition, what does that mean? For the well-being of the child. That study has shown that over 90% of children are exposed to air pollution. And we can only imagine what that does to a small child, that their systems are not yet fully developed. I was privileged to be at a session today that was talking about lead poisoning of water. And it's amazing what that is doing to all of us, but especially to children. And today, about 1/3 of children globally are exposed to lead pollution. In terms of the impact climate is having on water, I think it's something that we have all talked and known about. And it is estimated that up to 920 million children are exposed to water scarcity. What about nutrition? Up to about 24 million children are projected to be undernourished by 2050 as a result of the climate crisis. What future are we looking for these children that are going to be undernourished? It is, therefore, a crisis that is impacting on the rights of children and on their future. Now, UNICEF has developed what it calls the Children's Climate Risk Index, and this is a composite index that looks at the exposure to climate risks, the vulnerabilities that are there because of where the children are, and then their ability and capacity to cope with it. And so that index is what is indicated on this map. The darker the color, the higher the value of the extreme nature of the index. And as you can see, it's quite widely spread across Africa, and especially in the Eastern and Southern Africa sub-region. Quite a number of countries are within extremely high risks from climate change impacts. 60% of Africa's population is under 25 at the moment. How do we see what their future prospects are? And in terms of the countries, we don't have the names up there, but they include places like Ethiopia, Somalia, Madagascar, Mozambique, Malawi, Zambia, Burundi, to mention a few. Children are more vulnerable to climate and environmental shocks, and that we know because they are physically more vulnerable, physiologically not able to cope with it as much as adults, and they are at a higher risk of death from diseases that are coming up as a result of the exposures to the risks related to climate change. We need, therefore, to close the gap between climate policy and climate finance for children. Masuma talked about how invisible children are in the current policies and even the financing that is going towards climate change. Fewer than half of all the countries that had produced their nationally determined contributions and those that developed their national adaptation plans had anything to do or that were child or youth sensitive. 2 in 5 failed to address children's vulnerabilities across core basic service sectors. What do we need to do? The NDC processes are underway at the moment, and it gives us all, I think, a very big opportunity to make sure that child or youth-sensitive issues are reflected in those national documents, because that is the basis on which we can develop the strategies to target their specific vulnerabilities. What about financing? There was a report that was developed by UNICEF in 2023 that showed that multilateral climate funds that were child sensitive were found to be only 2.4%. That shows a stark gap. We need, therefore, to really make sure that the issues that are directly affecting children are financed, and not just putting the funds there, but really implementing and taking actions on it. Now, how do we do that? UNICEF has come up with a global framework on sustainability and climate action plan called SCAP. And the SCAP is founded on the principle that sustainability and climate action should be integrated across its own actions, but more importantly, partners and governments. And the three key objectives of that action plan is, one, to protect. And it is about protecting lives. It is about protecting the health and the well-being of children and the resilience of their communities. The second objective is around empowering, and it's about making sure that through the life course of every child, their developmental opportunities, education and skills are maximized. And then thirdly, it's about reducing emissions and our environmental footprint as a global community. Now, we've talked about the climate risk index. I won't go through it anymore because it's about looking at those vulnerabilities and making sure that we improve the rate at which the communities are able to cope with those risks. We are in the process of updating the Children's Climate Risk Index, and a new version will be released by September 2025, and I'm sure we will make it available for everyone to refer to. Now, some examples on how we bridge the gap between policy and making sure that children are visible there is what has happened with the government of Kenya. And in their nationally determined contribution, it was initially marked at 2/4 of child sensitivity. However, now it is graded at 4/4 because of specific improvements that include commitments on education, description of impacts on children, participation of children and youth in the process of climate action, and a dedicated action on youth and children. So this serves as a good example that we and governments can actually take practical steps to make sure that the specific needs of children are reflected and are acted upon. The other is on what has happened in Rwanda. And I think I'll just focus on the key lessons here that we want to emphasize. We need to make sure that whatever plans we are doing going forward, in whatever sector, they are climate sensitive. And we also need to make sure that we build capacity and especially evidence. What is the basis on which we want to take some of these actions? We need to have the evidence. And thirdly is to ensure there is multi-sectoral coordination across all of the sectors if we want to tackle the impact of climate change. Thank you.
Thank you very much. I'm sure we can do a warmer round of applause. You guys are going to hate me by the time this session is over. Right. When you guys came in, you were given little cards. There's a QR code behind it. And for some of the studies and reports that are being referenced during this and further presentations, if you scan that, it takes you to a Dropbox where you can download these reports. Going forward, Kitke mentioned a climate resilience WASH framework. Now, what does this actually look like? What is best practice? How it has worked? For that, we now go to Su Fang Gao, who is Chief of Health and Nutrition Services for the UNICEF offices in South Africa. She's going to be joining us online. And Dr. Su Fang, are you there? Okay, we'll just wait for her to join. And I will go through your presentation. Just let me know when you're ready, and I'll click the next slide. It's really weird seeing your own self on TV.
What we want to see is Sufang on TV.
Exactly, especially when there are more interesting people who have,
Oh, that's not to knock your level of interest in us all, Ms. Masuma. But seriously, is Ms. Sufang online?
There she is. There we
she
go.
is. Oh, great.
We can't hear you yet.
Oh, what's wrong?
No.
Now we can. Excellent.
Okay. Thank you, Chair. Good afternoon, colleagues. I'm going to share with you UNICEF South Africa's experience of developing climate resilient framework for water sanitation and hygiene services with technical support from the One World. I'd like to touch base on three areas. Why we need a climate resilient framework? What is the climate resilient WASH framework? And what's the way forward? Next slide, please. So why do we need a climate resilient framework? Next, please. South Africa has experienced a serious climate change events such as flood, drought, environmental degradations, which resulted in decreased soil fertility and crop yield, etc., and shortage of energy, which reduced water availability for hydropower, also impacted on energy services for food, sanitation, and so on. These are critical consequences for the future of children in South Africa, notably reduced physical and mental health, reduced education opportunity, and reduced livelihood and job opportunities. Next slide, please. There are also multiple threats multipliers, as some of you know, the triple development challenges, poverty, inequality, and unemployment. These increase vulnerability to climate change and have negative feedback loop. The huge inequality in South Africa, which means the vulnerable populations, especially children, adolescents, and women, especially in those in remote and informal settlement areas, cannot access to critical services such as health, wash, and education. Next slide, please. Moreover, in South Africa, Department of Water Sanitation wants to mainstream climate in its water and sanitation governance policy and programs through its national climate change strategy. Current guidelines and strategies focus on WASH. However, knowledge of WASH surveys, especially climate resilience, limited. Rural areas are particularly underserved. The infrastructure deficit facing WASH is a governance issue that must be addressed as a priority. Next slide, please. So what is the climate resilient WASH framework? So the primary objective of the framework is to establish clear criteria for determining the climate resilient of sanitation services, technology, and the system in South Africa. Its aim to support and guide the DWS due diligence process by articulating elements and define climate resiliency in basic services, as well as outlining technology and systems to mitigate potential climate resilient risk and shock. The framework is designed to ensure the continued accessibility and the functionality of WASH services amidst changing climate conditions and the extreme weather event. It specifically focuses on identifying and adapting sanitation infrastructure and practices to prevent climate resilient impact on WASH users, particularly children. The strategic framework identified in the figure has guided the work to develop the climate resilient framework for WASH services. It also guides the process for the implementation of the framework. So you can see it's include 4 components: understanding the problem, identify and appraise options, delivery solutions, and monitor and move forward. Next slide, please. So this is a very practical framework. For example, understanding the problem, we use risk-based assessment framework process following the 11 steps. Next slide, please. For example, in the phase of delivery solutions, we propose spreadsheet-based decision support as outlined here. Sorry, I can't go through the details. Next slide, please. So this framework can be used not only for planning and the design of WASH for new developments, ensuring infrastructure follows a strategy, but also for repair, refurbishment, and maintenance of WASH through implementation of no regret policies. Next, please. So this framework aims to provide clear guidance how to prioritize the implementation of WASH technology that can be modified to improve their resilience to climate change impact. Further, it also underscores the critical needs to embed climate resilient messaging and the capacity building effort into behavior change program from the onset. So the way forward is really require the Department of Water Sanitation to integrate it into its operation and disseminate it to other related departments, government agencies, and also partners in the private sector, NGOs, etc. It also mandate, if it will require the regional manager to incorporate climate resilient assessment into existing condition assessment tools. Further, it requires facilitating dedicated sessions with key stakeholders to promote successful implementation of the framework and align it with relevant department climate change strategies and the National Climate Change Act. Thank you.
Thank you, Dr. Sufang. Any questions with this particular presentation? Because our speaker is now going to go away and actually have a Sunday. But for the rest of us, we're going to have conversations with the panelists as well. Are there any particular questions for Dr. Sufang? No? It was a clear presentation, so I'm assuming nothing more at the moment.
Okay.
Thank you, Dr. Sufang. So we've heard institutional frameworks, we've heard WASH-specific frameworks, and now it gets to the interesting and more difficult bit, at which point I gladly hand over to Belinda to answer the more difficult questions on this.
Except I'm not answering them, our panelists are. So can I ask our panelists to come on stage? You know who you are while I introduce you. And in no particular order. Kitka you've already heard from, but as a reminder, he is the regional coordinator for WASH. or WASH advisor, I should say, for UNICEF Eastern and Southern African Regional Office. So Kitka's been involved in climate landscape assessments and WASH and climate resilience, among other duties. In all of that region, and bring some, as you heard earlier, some really important perspectives from the region that I think are also applicable elsewhere. Please do come on stage. I'll just carry on introducing. This very tall gentleman that follows is John Lane, who's currently chair of the Science Program Committee that is behind the SIWI seminars at this conference. So we're very grateful, John, that you could step away from your CWE duties and join us this afternoon. But the real reason I asked John to join us on the panel is he's got a very long history since the 1980s in water and sanitation, in particular in developing countries, very poor countries. I remember talking to you and your wife at one of the glamorous events that we used to have back in the day, on your time in Malawi, for example, which is an extremely poor setting. He also...
You're not going to repeat Masuma's gag about more decades than I care to.
I've already avoided that gag.
Fine.
Completely. I thought you would have noticed the ease with which I moved through that, John.
Completely.
Yeah. You could work it out, 1980 until now. Yeah, but and in that time, 1980 till now, but in the early 90s, I think John also worked for led WaterAid, and in that time was awarded a Stockholm Water Prize. So a fairly illustrious career, doesn't matter how many decades, really. And then Heidi Albert, who's our one panelist that is online, and I believe she is there. Heidi, welcome. So Heidi has recently joined ICLEI, who work with local government as a UN institution, as their global coordinator for health, and who has around 25 odd years experience working with local government in Africa and Asia, and has a passion, I believe, for data-driven systems thinking and locally driven solutions. So looking forward to hearing from Heidi how we bring evidence and local solutions together. And then our fourth but not least panelist is Michel Ngwisan, who's from the African Development Bank. He's the Chief of Water and Infrastructure Finance there, and has many, many years experience in water and pro-poor development in various institutions. I saw Michel, I mean, I've been working with Michel for the last, I don't know, year on the water, energy, food ecosystem Nexus, but I forgot to ask you about your history, so I had to go and look it up. And I see that it included an NGO and also GIZ, so some strong experience in programming. But obviously, we invited the African Development Bank to tell us how to find the money, really. So that is, colleagues, your panel. Let's give them a round of applause before they start to encourage them. All right, Kitka, I'm going to start with you. I think just because of your regional perspective, to remind us that we are bringing many of our insights from Africa, although, John, you probably go beyond. But Kitka, for you, what I really wanted to... Actually, you know what? I'm going to change feet. We've already heard from you. So let's give somebody else a leading chance here. John, let's go to you rather. Let's start with you. So without mentioning the number of decades, you have been in the space for a long time. And I think what we've seen in that time is that climate change, which is why we're in Stockholm this particular year, has gone from being a global issue back in the day that we used to gather together in a small group to talk about, and then it became a global concern, and now it's framed as a global crisis that's accelerating at a pace that we can't keep up with. And so one of my questions, and I've got two for you, this is the first one, is what, from your experience, do we need to do to accelerate the pace of change and to work differently? So it's 2 points to that question, isn't it? Acceleration and what are we not doing that we should be doing? And my other question, which is related, is that from your many years of experience of working on and above the ground, as it were, if I can put it that way, including in the wash sector, including in very poor places like Malawi, do you have any insights for us on the value that we could gain from investing in children specifically? So over to you, John.
Thanks very much, Belinda, and thanks for inviting me to join my fellow panelists here. I think it's fascinating work that UNICEF are doing with support of One World, so it's great to be here in this discussion. So your first question about how to accelerate the pace of change and then how to work differently. To accelerate the pace of change, this sounds like a slightly odd piece of advice, which is that we do need to communicate that it is a crisis. I mean, you've expressed it very eloquently, and people who are working in it all the time are very well aware of it. That East and Southern Africa as a region has a much higher level of awareness of the urgency of the crisis than some other parts of the world. And so by communicating to leaders about that, we don't want to make them panic. But what we can do is to offer solutions to help them to address that crisis. They're busy people. You know, they themselves have got a lot of demands on their time. They may not be so aware about the nuances of it. And so it's really up to us not only to communicate that this is an urgent problem that we're facing, but also to be helpful and offer them solutions. I thought the risk index was a really interesting tool. That's the kind of thing that political leaders are very keen to see. You know, where am I on the list and how am I going to get better? Those kind of tools can be very helpful. Okay, and then the second part is working differently, and this also answers what are the tools that we're offering to help politicians. I think the big difference in working in sanitation now compared to, say, 30 years ago, is that we're now aware that sanitation can contribute significantly to mitigating greenhouse gas emissions. So we're not standing there and holding our hands out and saying, our work is very important, please give us money, because that doesn't work with heads of state and ministers of finance, because there's a queue of people waiting outside their door to say exactly the same thing to them. But if we can say, look, there's a problem here that you're wrestling with, and we can offer something to help mitigate the climate change, then people will listen. And if we look at methane emissions from human excreta in general, we're not sure exactly, but they're somewhere between 1% and 2% of total greenhouse gas emissions. And that is an enormous number. So by ensuring that our sanitation programs do the best that we can to either minimize or indeed capture methane emissions, we can demonstrate that it's not only a kind of give mentality. And I think that's going to be the key to helping leaders to overcome the problem, and that's the main difference in how we're working now to how we used to be. I'm very keen on the whole concept of climate resilient sanitation, and a very big element of that is the mitigation element. On your second question about the value of investing in climate resilient wash for children, there's some very interesting work that dates back to about 20 to 25 years ago. The person that really led the intellectual effort on it was Guy Hutton. And we took that work as part of International Year of Sanitation in 2008. And the message is that $1 spent on improved sanitation generates at least $5 of economic benefit, plus all those other benefits that we're familiar with, the benefit of health, benefit to education and the environment and so on. So there was some very robust and tangible data. It was developed by the World Bank and by UNICEF, and it's still, current data, if you like. It's not old data. It's still current data. So it's very clear that sanitation investments are cost beneficial, if that's the right adjective. And then if we look at children, sanitation for children, of course, that's the most important. And Kitka has communicated this powerfully to us already, not least because those children have the longest lives ahead of them. And so if we can ensure that they will survive the first year of life because they're not going to die of diarrhea as small babies, that we can ensure that they're going to thrive, that their nutritional status will be good, that they're then going to grow up into healthy adults, they can look forward to a 70 or 80 or 90-year life expectancy. So, I mean, my goodness, there's nothing more important than investing in the future health of children. And child health is popular with politicians. Sanitation is not. We know that. But if we can then hang our sanitation programs on the peg of child health and child health funding, that will help us to access one particular line of finance. And then another line of finance, which is now, and Belinda and I were just discussing this before the session started, you know, there's a lot more money out there in general with a mitigation sort of label attached to it compared to adaptation. And we know, because we work in water and sanitation, that we've principally been trying to pitch for adaptation, and you know, that's not where the money is and it's not where the politicians' interest is. So if we can pitch our work, such as the work that you and your colleagues are doing, as a mitigation task, or under the mitigation label, that also gives us access to another very powerful and popular funding stream. So climate resilient wash, you know, actually it's good quality wash. You know, it's wash that's been well thought out, good institutions, good training, good planning, high quality of technology, you know, work that's really done properly. And those are characteristics that are appealing to anybody. They're appealing to financiers in particular. So whether we use the label of climate resilience, there are other labels that we can use when we're talking to financiers, and Michel is going to say a lot more because he knows much more about it than I do, that will enable us to tap into significant financing streams to support all this excellent work that Kitka and his colleagues and others are doing. Thanks.
John, thank you. I mean, thank you for talking about urgency, but also bringing some very practical, constructive, I think you're trying to look at solutions for getting there and for helping our politicians instead of just moaning that they're not doing what we want them to do. And I think the numbers, and I agree with you, the statistic that you gave is still current research. To translate that, Kitka, I think is going to be important, that number, into a number for children, because I have a feeling that if we did the maths properly, we'd probably find that it's an exponential return on investment. And of course, John, the points you make around raising finance aligns very much with the current trend around results-based financing that we're seeing. You know, the World Bank was talking at the African Investment Programme conference in Cape Town the week before last about wanting to see returns on social, on environmental, etc., and measured. So, and I think the the CCRI, the risk index that you were talking about, Kitka, helps us to measure our progress accordingly. So, John, thank you. We will come back to you, so please don't disappear. Kitka, I am now really going to come to you. You know, I think something that we've been observing in the work that we've been doing in various countries, and please don't feel constrained to the countries we've worked in. You've work in many more, and that's absolutely wonderful to get those insights. But there seems to have been a sort of green turn in the human rights arena. And, you know, just in other words, an accelerated focus on environmental issues as a human right. And, you know, I'm not going to name all the conventions and rights instruments that we've seen this in, but let's just talk in terms of international law. And it's an approach or a thrust towards ensuring the rights of current and future generations. So it's the intergenerational equity aspect. And I suppose what sort of comes to mind for me, and I'm sure many, including our financiers, is how do we ensure that the efforts that we make to ensure those environmental rights for children actually happen is going to pay dividends? for our children and our society and economies going forward. Including, for example, in climate resilient WASH, and thinking about those objectives you were talking about around empower, reduce, and protect. And then my follow-on question, and I'm happy to repeat it later if need be, is how do we ensure child participation? So if we're assuming that any child that is of an age or facility to actually express their point of view, that we hear that point of view, how do we bring that into the pathways that we are busy charting?
Great. Thank you, Belinda. And actually, I'll start with the second question because it's easier. Child participation, I think there are two angles to it. One is about raising awareness and building those skills as children grow. We have the cliche, catch them young. Once they are able to have these skills right from childhood, the tendency is they take it up to their adulthood. There is what is called the participatory action research, a methodology that UNICEF has developed, a tool that you can use to involve children in their communities. Okay, just to be aware of what is happening in their immediate environments. What have they seen as changes? What is the trend on certain things? The rivers within their communities, have they noticed any changes in the flow of water in it? The trees, the vegetation, all of those kind of things. And if they begin to now build on those trends and see what is happening, the chances of them taking practical actions to mitigate those changes that they have seen going to the negative trend would be a lot stronger, and it's something that can be carried forward into the future. So I think involving children from that early childhood stages will be good. The other is about curriculum in schools. Do we have any kind of topics about climate change or not? Are we able to put them into those curricula so that children now grow up with this awareness? And those that are at an age that can contribute to their own community and how things are changing, how do we involve them in terms of participating in discussions within their communities, either with the community or even with duty bearers, on what is the impact of climate change, how do they perceive it, and what do they see as actions that could be taken to mitigate some of these and overcome them. I think if we do those, we will be able to secure children's future by having them part of that, as part of that solution. In terms of the returns and in terms of investing in climate resilient water and sanitation systems, and I think this is the biggest challenge for us in the WASH sector. How do we communicate this? What is that additionality we are bringing to the usual work we are doing to make it climate resilient? What is the rationale? What is the science behind it? And I think sometimes we communicate, floods are becoming more frequent and at a higher level of intensity. The droughts are getting higher and temperatures are on the increase. But do we have that evidence base documented and indicating the trend or not? And I think these are small steps, maybe incremental steps that we need to take, and also maybe to engage more with the climate science and the climate scientists, bringing that knowledge and applying it on the impact of on WASH, and then we can communicate it more, strongly, so to say, with more evidence. And if we're able to do that, then we show the additionality of climate resilient systems and the benefits that they bring to society and community. I think that will go a very long way in trying to change that. Also related to this is the issue of working with governments. I think we keep going back to the need to really make sure that our national leaders and those responsible for these activities are fully on board with whatever these trends are showing us and what the actions that are needed to overcome these are in place. And this we can only do, again, by involving them, by making sure we communicate that evidence, we communicate that change that is needed in a way that they buy into it, without which whatever actions we do are going to be limited and the scope and the impact will not be as what we want. Thank you, Belinda.
Thank you, Kitka. And yeah, I think, you know, in terms of answering my more difficult, apparently, question last, it's a great response, I think, in the sense of bringing, you know, the political leaders on board. That's how you get returns on your investment, I think is what you're saying. But your earlier response to my first or other question around bringing the participation of children and bringing them on board. So you've kind of taken us from the child to the political level. And I think that's a very important trajectory. And I can see a diagram going on around, you know, drawing those dots and making those connections. And thank you for bringing the education in. Maybe not what you were saying, but I was reminded that when I first came into this space, and I came out of the corporate sector and I was doing completely something else, and I needed an education in the space, and I couldn't find anything, any course that I could go and do. Then we, you know, anyway, I went and did it anyway, but we started recruiting people, and now that space has changed completely. I get master's degrees in climate finance. You know, I'm losing a staff member to a master's degree in climate finance. So yeah, that space has changed. And I suppose what I'm saying is it's as much about educating children around their options, but also preparing them for a very different future in the world of work, which is, I think, critical. We're now going to go to our online panelist, who you will remember is Heidi Elbert, who's Health Program Coordinator for ICLEI, with this long history in health and local solutions. Heidi, greetings. I'm sorry you're not in the room with us, but some of your colleagues are, which is great. My two questions for you, Heidi, are firstly is how could local institutions be leveraging their mandates to deliver climate resilient health systems for our children? And I am cognizant of your appreciation of local solutions. So I'm just wondering if you could share with us what you think those could be. And if you can, I would appreciate a comment on how to make sure that we embrace informality in that regard. So local government, I don't think, is always brilliant at working with informal settings, and these were alluded to by Sufong as well in her presentation. And then my second question for you is, yeah, I mean, it's been one of our findings, Heidi, that the health impacts of climate change often come downstream of, say, a flood event. You know, the flood event happens, the emergency funds get disseminated, and then afterwards we find out everybody's sick, and children suffer the most, and the funds have dried up. And it's very, very difficult for the health sector. So I'm interested in how any sort of experiences you might have had, any tips you might think of for any of us in terms of promoting cooperative governance in a way that alleviates that sort of surprise factor for the healthcare system. But that's cooperative governance obviously across sectors, because agriculture sector could be doing more to prevent malnutrition, for example. But it's also across spheres, I suppose, of governance. So, between local and other subnational governance structures and national. But let's start you off with my first question, is how could local institutions leverage their mandates? Thanks, Heidi.
Thanks, Belinda. Just checking you can hear me okay, because the sound on my end is not great. So let me, hopefully I can answer your question well enough. You can check in if not. So maybe first of all, a big thank you for inviting me on this panel, and particularly it's a privilege to be in this session and among such very distinguished panelists in the field. So as you mentioned, I'm heading up ICLEI's Cities Health Centre based in Cape Town, South Africa. And ICLEI is a global network, for those who may not be familiar with us, comprising more than 2,500 cities and subnational governments committed to sustainability. So really we
Is this when I call on our sound man? No. No. Okay. Heidi, any chance you've potentially muted your mic by mistake? And you can unmute? No. All right. I think, Michelle, that brings you forward. So we'll go. Heidi, hopefully we can resurrect the sound situation, but we're not getting you anymore, unfortunately. So what I'll do is just go to our next panelist, and we'll give you an opportunity to come back again after Michelle has made his inputs, and hopefully we've sorted something out by then. Michelle, reminder, Michelle Nguisen is from African Development Bank. He's going to answer all your tough questions about where the money is going to come from for all of this. And Michelle, bearing in mind some of the comments that have already been made by these panelists, John's comment that health is big on politicians' agenda, but sanitation is not. And we know this, right? Because we look at sanitation figures year after year. We did this with all the UNICEF work that we did. What is each country spending on sanitation? And I took you out, or asked you to take me out for dinner last year, John, to go and try and find out what the solution was. And we talked about everything else. But yeah, so just bearing in mind that sort of, and John's very important message that we frame things differently. But before we get to those specific points, Michelle, I'm interested in, obviously, in the water, energy, food ecosystem Nexus work that you've been leading, the team in the bank on recently, and your switch towards an approach in making Nexus-related investments is important. So I thought you could perhaps tell us a little bit about that and your rationale more than anything. Why did you want to do that? Because I think it's really relevant to the Nexus we're talking about here, which is the climate child health Nexus. And so, you know, my question on that is, first, tell us a little bit about it, and then please tell us how you see the water, energy, food ecosystem Nexus portfolio that the bank's embarking on, how you see that benefiting children. So that's my first. And my second question is possibly a bit of a mean question, but I'm going to ask it anyway. And that is how does the AFDB, or how could the AFDB ensure that its investment portfolio secures the rights and the opportunities for children by ring fencing, for example, or dedicating a portion of your portfolio towards child investments? Over to you, Michelle.
No, I mean, thank you so very much, Belinda, and all the conveners, I mean, for having us here. We're extremely happy to be here. I just wanted to start saying that, the reason why we're here is not only because we were invited. It's also because we believe in what we're discussing here. It's extremely critical, to understand that, health is actually the foundation of any social and economic, progress. And as you know, we are a development bank, right? And one of our mandate, if not, the mandate of the institution is to support all our regional member countries on the social and economic, development efforts and agenda, right? So sometimes we just sit and then we actually wonder how we can approach those. But there's nothing, we can really do about economic and social progress unless we address the issue of health. If we don't address this, of course, or maybe if we address this, let me actually approach it on the positive perspective. The better we approach it, the better, we address it, the more chances we're going to have, to have healthier population, more productivity. I think we already discussed this on economic forums. Also, perhaps a more sustainable, and quality labor force, and of course, less impact on what we call balance sheet, or maybe on economic, expenses, from the government. So all those are extremely critical for us. I think we understand that. We have to address it. Unfortunately, the reality in Africa, and I'm going to talk about the perspective from Africa, is really different, right? I think I was expecting more of this. I was trying to make some researches. And I actually found out that one child born in Southern Africa has something around 18 times more chances, right? To actually die before 5, compared to a country like New Zealand or so on and so forth. When you look at, the death rates, I'm coming from Cote d'Ivoire, I'm Ivorian, right? In Cote d'Ivoire, I think it's around 60, 59. But they are even worse. When you look at countries like Central African Republic, which is a country that I also cover, they're around something like 97, right? For 1,000. You go to Niger, it's 1,000. It's actually 100. DRC, 110. Very rich country. But, nothing worse because they don't address this kind of issue. So all those are statistics that we from our perspective, we can only ask for more money from our boards if we have evidence. That's the major difference, between us and most of the institutions. We always function based on evidence. So, trying to understand this, we also went further, right? Trying to understand how we could approach those issues which are sometimes undermining the economic and social development of our countries. And we clearly understood that issues like fragility and conflict. So depending on the kind of country you actually work in, you're more likely to face those kind of issues. And all the countries that I mentioned, including Somalia and so on and so forth, we will all understand that those countries are either in conflict or they're very fragile, based on our prism of fragility. The other issue is also the access to water and sanitation, right? It's access to power. Like my president usually likes saying, you cannot develop in darkness, right? So there's nothing you can do. So unless you address the issue of power, you can hardly, develop. And of course, a country where the ecosystem is not conducive, people will more likely, die or maybe get sick. I think the gentleman from UNICEF brightly, mentioned it. There is a huge percentage of children, right, exposed to pollution. That's an ecosystem issue, right? So we actually look at this, and then we internally decide, to rethink, right, the way we address this, because while going to our deep dive, we also understood clearly that the main issue, or maybe what is going to help us, address those issues, are not the amount of money that we're going to bring, because there's already enough money. Actually, absorption capacity has been an issue in most of the countries. The other thing is not the level of technology or maybe the innovation which is going to make a difference. But we ended up, saying that we need to revamp the way we approach it. We need to streamline our processes, right? So what approach are we going to adopt in the way that we bring a bit more effectiveness in the way we work? So at the bank, we are not reinventing the wheel, and we already have department focusing on water and sanitation. We have a health department, we have agriculture department, we have natural resources department, and so on and so forth, right? All of us, we are doing our lending programs, billions of US dollars every year. For example, I think I'm also going to come back on this. Last year, we actually approved something in the region of 11 billion US dollar, only 1 year. The year before it was 10 billion. That's a lot of money. But in terms of impact, of course, we also making some changes. But my personal view, and that's not the view of the bank, is we can do more. We can do better, right? But all, lies on the way we approach, what we're trying to bring as solution. So that's actually how, the idea of developing a framework, came up. But now, right, just to respond to the question now, how do we make sure that, we actually consider the children, right? For us, it's quite obvious. We have a policy on focusing on youth and gender. So we all understand, right, that if we address all the KPIs, the sets of KPIs for those who have had a chance, to go through the investment framework, if we properly, address this issue across the different sectors, we all agree that, we would have addressed at least three-fourths, or let's say 75% of all SDGs. And if we address all those targets, it means, the children are also, considered, and all the solutions are also, addressed. And we can clearly see, I think we're here in Stockholm, we can see the quality of life here compared to some of the countries where we're coming from. I'm not trying, to blackmail anyone, but that's a clear difference, right? What have I done, right, and we are not doing right so far. That's this kind of issue, making sure everyone has access to power and electricity, everyone has access to clean water and sanitation, affordable sanitation, a bit expensive, but very important. But also the ecosystem is properly, overlooked. So yeah, that's how we approach it, and we clearly think that, over the next few years, because we actually have, just to jump on the second question, we now have an ambition, to deploy something in a region of 1.2 billion by 2027. We already have the pipeline identified. For those who are also not familiar with the way MDBs work, we have a 3 years rolling agenda or pipeline of investable projects. So those projects are already known. And by 2027, we intend, to deploy something in the region of 1.2 billion US. By 2030, we're looking at deploying something in the region of 4.8 billion US only on this matter, which is going to help us. When I say us, I'm talking about the regional member countries, accelerate, delivery on those objectives, making sure that, there is more healthier, environment, healthier, use, but also more, bespoke solutions, for children across the continent. So yeah, just to remain here, that's exactly what we can say, but we can say a bit more in terms of solution that looking at, because one of the issues that most colleagues here on the panel have not perhaps touched is how do we create an environment for private sector to also come in. We definitely talking about 4.8 billion US, but government alone, cannot invest 4.8 billion US, right? We need, to find out a way, to enable the environment in the way that private sector is also happy, to join. And this kind of work that we're doing, and we're extremely grateful, for the work that One World has helped us, do. And this is definitely going to pave the way towards crowding in, a bit more private capital and also, additional resources to support this development agenda and targets. Thank you.
Michelle, thank you very much. And for a number of things. One is it's always refreshing to hear that the money is there. Right, because especially at the moment, everybody's talking about how the money is reducing. Various people up in the north we are in the north now, aren't we? I'm forgetting I'm not in Africa, but are making development finance and especially climate finance dwindle. So, but it is a question of absorptive capacity. And your last point about the private sector is key, I think is important. And I'm sure the floor will have questions for you as well, and the panelists, you can be part of the floor when we get to the interactive section, but I will go to Heidi first.
I'm just joking, I think happy.
But I think it's very, very comforting, I don't know what other word to use, to know that we've got a multilateral development bank on our doorstep that understands our doorstep to help us find financing solutions. Heidi, before I go to you, my colleagues on the panel have been banding about a number of statistics, and I feel obliged to respond with one of my own. And John, you'll like this because you're worrying about mitigation and emissions from human excreta. My stat's not about that. But the agenda and what we were talking about just before the session and why there's such a strong focus on adaptation is because Africa is such a low emitter relative to the rest of the world. And the statistic I wanted to give you is that the average American citizen emits 23 times more emissions per capita than the average Nigerian. And it's an interesting economy to choose, right, to compare with Nigeria, because it's one of the two biggest economies on the continent. Yep. So it's an instructive figure, but you can do with it whatever you want. Heidi, I'm hoping we've got you back. I can see your face, which is encouraging. So just my two questions. How do we leverage local government mandate to find local solutions that work? And how do we get to improved cooperative governance using that local government mandate? Thanks, Heidi.
Thanks, Belinda. I hope you're able to hear me okay.
I can hear you. Heidi?
Are you able to hear me?
Yes,
Belinda?
we can hear you. I don't know
Okay,
if you can hear
perfect.
me.
Thank you. Yeah, thank you. So I think jumping straight in. So I think to answer your first question, I think as we know, cities and local governments are really on the front line of both climate and public health challenges, crises. Really the first to respond in case of floods, droughts, and heat waves and other shocks. But importantly, the closest level of government to the communities that are being most affected. So we know that in terms of child health, this is really multidimensional. We're obviously focusing here on safe and reliable water and sanitation, but thinking beyond to the other sectors, education, housing, health infrastructure, environment, social services. So we know that health policy is typically at the national level, set at the national level, regional level, but really all these key health determinants are core mandates of local governments. And I think the really important point that I want to make is, as you say, like how can we better engage with local governments across the different levels, national, regional, and global, to make sure that we recognize the fact that local governments are not just implementers of global agendas on climate and health. They're actually innovators. They're the ones who adapt the solutions to the local reality. They can understand at a granular level what is happening on the ground in their communities, and really drive, I think has been already mentioned by a couple of the panelists, the sorts of interventions that are needed. So as you say, we need to look at multi-level. We need to really have ownership at a local level that can sort of link up to the national and then even the global agendas, but can also work across sectors at the local government level, but also looking down to the communities and how to effectively engage the communities. I think as one of the colleagues has already mentioned, really important to have community as well as youth and children engagement in designing solutions that are actually going to work on the ground. So I think in terms of how things happen at the local government level, we really need to mainstream health into climate action at that level and vice versa. We need to make sure that health is also looking across all these different sectors. And then I think just another point to mention, I'm not sure if you caught this in my earlier comments, but we also, so ICLEI is the designated representative, making sure that local and regional governments' voices are heard through the global UNFCCC processes in a systematic manner. But still, I think there's still work to be done in terms of particularly the climate and health intersection. So I think really looking to see that the local government voices can be heard more at a national and global level to really advocate for investment and ways of working, new ways of working in a more joined up fashion. So I think that's going to be one really important aspect that I wanted to emphasize, that we want to see policies turn into meaningful action on the ground. I think having that stronger local government investment and building capacity at that level is really going to be critical. So that's for your first question. And then I think you spoke a little about sort of how do we I'm sorry.
No, please carry on, Heidi.
Oh, I thought you were jumping in. On your second question, Belinda, you were speaking, I think, about how do we also sort of see that the health impacts that we're seeing are really downstream? How can we sort of measure those? How can we make sure that the health impacts are understood and then factored into planning and decision making? And I think, as has been mentioned also earlier, I think having this granular view of firstly, where are the risks for children in communities, seeing that at a granular level and seeing the sort of cross-secting drivers of risk, but then also being able to see, as we put in place various interventions, how can we measure the impact? So are the activities or the interventions that we're putting in place, are they showing the sort of impact on children's health that we would be wanting to see? And if not, can we use the data in a more dynamic way at a more granular level to actually course correct and see how we need to change what is happening on the ground? So I think being able to do these sort of health impact assessments at the strategic stage, at the project or program stage, but also having better ways of monitoring that impact from a health perspective and not just from a climate perspective at a local level, I think is going to be really critical. And so that's, I think, an area that we want to be supporting local governments in improving that capacity. And also, I think that's an important aspect. I think there was some the previous panelists were speaking about, unlocking, how do we unlock investment? So I think it's really heartening to hear about investment possibilities. And I think being able to unlock climate and other financing, it's going to be really critical that we can show measurable changes in health of children at that level, and being able to make the most impactful investments that are possible. So I think those are areas we want to see that local government voice can be brought to bear on global and national planning. But also, we need to mainstream health and particularly children's health at the heart of climate action. And I think also to remember that, in focusing on children's health, we also benefiting many other vulnerable groups within the community as well. So I think that's something we can also emphasize when we're speaking about this. So maybe let me pause there.
Heidi, I'm so glad that we were able to resurrect you, as it were. that was a great input. And I wasn't looking at my fellow panelists, but John, I think I caught you nodding your head in agreement. And I thought the point that Heidi made around climate health impact assessments and your point around politicians are interested in health but not sanitation, tied up really well. So there's some very nice joining of the dots going on here, which is great. It's quite hard to see in these bright lights, but I've got less time than I wanted for the interactive panel, interaction with the panel. But we can take 2 questions. So are there any, firstly? And panelists, please do be reminded that I am going to be asking you each for 1, maximum 2 key climate actions going forward. But are there any questions from the floor? Oh, we'll take you. Thank you.
Okay. Good evening, everyone, and congratulations for such brilliant presentation from all the panel. I'm Angel Assiam from Chad, civil society, and it's a pleasure to see such efforts that it's implementing in the sector. I have actually a question with two dimensions. The first question, maybe it's related to the presentation from UNICEF, the engagement of youth, because when we talked of how to get more youth involved, most of the time, at least in Sahel, and I can only talk on in the context of my country, Chad, we see that in terms of education, there is a disconnection with the ancestral knowledge, knowing in Africa culture, most of the transmission is oral from the elders, and this is not, so I was just wondering if the tools that you are designing is also considering this aspect and how you integrate it into this global. The second question, maybe for the World Bank, sorry, for the African Development Bank, it's we know Africa has the most highest index for youth growth in the world, right? So this is an opportunity for any economic development, but most of the time, the impression I have is that the tools, the financial instruments, it's not always integrated youth as part of, sustainable solution as part of the process, but more in a punctual actions, campaign, or some of these. So I was also wondering if at the World African Bank you also have a policy to actually integrate this as a powerful option for sustainable jobs creation, for instance, to integrate this sustainability in the African context. So thank you.
Thank you very much to our colleague from Chad. Is there one other question? I see one at the back. I'll let the microphone choose. I don't know who came first. I'm sorry.
Yes, thank you very much. Jean Lepec from Action Against Hunger. It was a question related to the availability of funds. We had massive fund cuts in 2025. This impacted directly UNICEF and most of the NGOs. And basically, we are happy to know that there is fund. But last year, I was also at the African Water Week, where there were big debates about the funding of the NAPs. And obviously, the funding was not here. So the climate adaptation was also at stake. So it's just to be clear about the message we are telling, the story we are telling. We are still telling the story where basically the climate adaptation, so maybe what you said, the politicians prefer to put on mitigation than on adaptation. But the reality is that the adaptation is what the Global South needs and what is not funded. Thank you.
All right, thank you. Let's take the hand at the back and then we'll stop. I don't want to be unfair. Thank you.
Thank you very much. Name is Wandere Joseph. Working with Carlo in Somalia. So I'm pretty happy to hear that some of the post-conflict and vulnerable environments are being considered. My question actually also relates to the issue of funding, because while the funding might be available, the question that always comes up at the end of the day, where is it available? I think we're also cognizant of the issue of localization of development funding, but also closely related to that, I would like to also highlight that part of the issue that we have is when the funding is available, it's available at the national level. And I'm glad that you brought in panelists on local governance. How do local governance or governments access this funding because they are equal decision makers. And also communities. When we're also talking about children as people that we want to involve in decision making or accessing decision platforms, how then do we relate the inputs they bring on board and have those inputs funded or those needs addressed at their levels? Thank you.
Thank you very much. Some great questions from the floor. So I'm going to bounce these to the panelists. We've got very limited time, so please keep your responses short. Kitka, I think I'm going to start with you. There was very, very specific question from Chad on transmission.
Yeah. Thank you. That was really very relevant. I think the issue of children's involvement and their participation is one that we as development partners should really think about, that word participation. How effective do we engage them? How meaningful are their contributions taken on board? I think it's a question that we should all take. And that is why we call it participatory action research. Okay? It's more like looking into that specific context and trying to tease out what it is that the children perceive as the issues. Now, it's not going to be taken in isolation with what the elders, as you rightly stated, in our context in Africa, the elders and their wealth of knowledge and experiences also is very, very critical. So then these two are brought together, and then the actions that are going to be agreed upon would be one that is based on this perception, but also based on the experiences and knowledge that exists within that community, so that this action would be one that would be sustained and be able to bring tangible results. Thank you.
Thank you, Kitka. John, I think a couple directed at you, but on the financing, no, I'm talking to you, John, but on the comment that was made about more money is needed for adaptation in the global south, and given our conversation earlier, I just wondered if you could make a quick remark about that.
No, absolutely right. I'm completely with you. That's right. The global north is responsible for creating the entire mess. And is very, very slow in recognizing its responsibilities. And yes, of course, you're absolutely right, that adaptation money and also mitigation money we've talked about anyway needs to flow more quickly and in much larger quantities from north to south, no doubt about it.
And also maybe in a more integrated way. What John and I were talking about earlier is that the distinction between adaptation and mitigation is not so useful these days as we once thought it was. And we've moved anyway towards a conversation on resilience, which brings both together. Michelle, I'm going to come to the man with the money last. Heidi, there was a great question for you on local government and youth participation and meaningful integration.
Yeah, thanks, Belinda. Thanks for the question. I think this is really critical, and I think it's across different interventions at the local government level. I think this is increasingly being recognized as a really critical element. And I think what one of the sort of areas in particular, I think, where this has been seen to be really valuable is really that, it's not just about sort of engaging with youth and children, it's acknowledging the fact that they're able to also surface realities that often the adults may overlook. So I think it's not just about having them in the room and consulting, it's really about recognizing that, they are the future, but they also are bringing up different challenges that we may have overlooked. I think some of the mental health challenges related to health, to water scarcity, etc., is just one example. So I think we need to be very intentional about the sorts of inclusive processes that, we're bringing to bear on these kind of planning and action. And I think, also working with partners around the innovations that come out of engaging youth in governance processes at the local level, and designing and actually participating in the interventions themselves. So I think on all those levels, I think engaging the youth is not a nice to have, it's an absolute essential.
Yeah, and the innovation, I think, is something I've picked up from both your interventions. Michelle, the issue of development, adaptation, mitigation, finance, but I think the job creation question was interesting, and of course we had that in Senegal as well.
No. Absolutely. Those are extremely critical questions. So I actually took note of few aspects that I just wanted to, if time allows, address. First one is the level of climate finance. I was just mentioning, when you look at the spectrum of the investment of the African Development Bank, at least I can talk about the African Development Bank, 55% of this total investment last year was climate related. That's extremely important to understand. I didn't want to focus on the issue of climate finance because there was, for me, most important things like health and Nexus, relationship. But on the climate finance side, I think the bank is quite bold. For those who actually follow the trend at the African Development Bank, you can also understand that we have recently, in the context of the ADF 16, which is our concessional funding window, established about another sub-window called the Climate Action Window, through which we have mobilized another 429 million, right, to deploy over 2 years. And clearly, water, power, and agriculture were the key priority areas. 25% of the first call for proposal was actually dedicated to water, and again that's also where we wanted to leverage the power of partnerships in alignment with SDG 17, where we think that some other organizations have more leverage, like on the issue of children. We have been working with UNICEF, even myself. There are 2 countries where I was working. I literally, supporting, working together with UNICEF. So we have channeled some resources, to UNICEF to reach this, portion of the population, because we think that, we need to adopt or maybe address those development issues holistically, and there's no way, children can be left aside. When it comes, to youth, we all understand that, the issue of demographic dividend is actually, in the case of Africa, a time-taking bomb, right? If we don't do anything, in that regard. And that's the reason why, the bank has been extremely intentional, setting up what we have called the Youth Entrepreneurship and Investment Bank. As of today, a few countries have already benefited, from this. Next action for the bank from next year, 2026, is to set up what we call job for youth market system. We already have a gender market system. So this market system is being developed, and now no projects, not even one project, can be considered by the board unless it has a clear section on how we're going to address the issue of job for youth. So that's actually sends a clear signal, right? Even this morning I was working on a project in Burundi. I think Burundi. That was one of the questions that I received. So we now hope that by mid next month, I think this project is going to be approved. But for us, it's quite clear. There's nothing we can do unless we address the issue of youth. So at least from the perspective of the FDB, that's something we take very seriously. Next aspect, it was the financing at the local level. I think even from our side, unfortunately, we're not a commercial bank, so sometimes we don't make publicity. But we're also financing a lot, right? We have a trust fund called Urban and Municipal Development Fund, which can easily deploy resources to support project preparation, but also some critical investment. So I would perhaps invite you, for those who are interested, to go to the bank website and seek UMDF. That's a very interesting, platform from where, you can also leverage from some resources, to support the development at local level. And last but not least, everyone talking about reduction and shrinking of resources. I wanted, to tell my fellow water and sanitation professional, there's no entitlement when it comes to investment. No, each and everyone has to make his case, right? If you want, any investor, to come to you, you have to tell him exactly why you think you are a best option. To reach certain level of impact than another sector like power or transport, and that's something very difficult to make. But within the bank, at the level of water and sanitation department, we have been very intentional, in addressing this. Actually, last year we mobilized our first regional project, benefiting, Central African Republic and DRC. And imagine, that was the very first time, the bank regional envelope was financing a water project, right? But it was structured in a way that it was very marketable, to them. And one of the benefits of this mechanism is, for a country like Central African Republic, benefiting from about 40 million, right, for 3 years as PBA, the allocation. They receive 89 million grants, 89 million, but just committing 4 million. Yeah. That's the mechanism that we're trying to actually leverage, right, with them. So you have to know this, not only, but also be very, have the capacity to set up or maybe prepare those kind of cases so that the investors can consider. So yes, the funds, I'm not saying that the funds are there and they're actually enough to cover all the needs, but one thing we must understand is, in terms of capacity, to deploy the capital, we have been very weak, right? So there's a room, to mobilize more resources, but we need to build in-house the capacities, to deploy those resources when they are given to us. We don't want projects structured, for 3 years that last 10 years, which is most of the time the case in our countries. Thank you so much.
Thank you. And thank you so much to our panelists. I think you've given us call for action. I was going to ask for the last round, but we're out of time. You've been amazing. Thank you very much.
Thank you.
Right. So the nice thing about doing this on the first day is now you have 3 more days to track these people down and sort of ask them more questions. Thank you very much for being a patient, supportive audience, for listening to the entire story that we were trying to tell. And this is the summation. You need to have evidence. You need to be able to communicate it. Use children as resource and not just a problem. And things will happen and they will get done. That's the best summary I can give you. Thank you very much and enjoy the rest of your evening.